After 60, the body begins sending quiet messages long before most people notice them. A little tingling in the toes, a faint bluish patch along the calf, or that heavy feeling in your legs at the end of the day. Many people brush these off as signs of getting older, but in reality, these small changes can be early warnings of something much more important, something many seniors never learn about until much later. And if this is your first time visiting the channel, I am truly glad you are here. Feel free to hit subscribe and tap like so you can stay updated with simple, practical health guidance that supports you day by day. Our MediSense community always appreciates hearing your experiences. Your story may be exactly what someone else needs to hear. Today, I want to walk you through something that affects millions of older adults yet rarely gets talked about clearly. Why veins in the legs start to bulge or darken, why swelling or numbness begins to appear, and why those sudden nighttime cramps feel like they come out of nowhere. More importantly, I will show you 4 natural vitamins that play powerful roles in supporting healthy blood flow, reducing the risk of clot formation, and helping your legs feel lighter and more comfortable as you move through your day. Over the next 20 minutes, you will gain a clearer picture of what is actually happening inside your legs, what these signals truly mean, and what small choices you can start making tonight at dinner to protect your circulation and maintain your independence as you age. When circulation starts to weaken, the body often whispers before it ever raises its voice. One of the earliest signs shows up right on the surface of your skin. You might look down and notice that your feet appear unusually pale, or they seem a little bluish, or maybe there are darker patches that were not there before. Many older adults tell me they assumed it was just dry skin or a harmless color change. In reality, these shifts can be your body signaling that oxygen is not reaching your legs the way it should. Healthy blood flow brings warmth and color. When that flow slows down, the skin reflects it long before pain appears. Another common signal is a sudden cramp that stops you mid-step or wakes you in the middle of the night. That sharp, tightening pain in your calf is not random. It is your muscles asking for more oxygen than your arteries are able to deliver in that moment. This pattern is so common that in medicine we have a name for it. It is called intermittent claudication. Many people think it is just part of aging, but it is not. It is often a sign that the blood vessels in the legs are narrowing or struggling to push blood forward. You may also notice tingling or numbness. That pins and needles sensation can feel mild at first, almost easy to ignore, but it is one of the clearest indicators that your nerves are not getting enough blood. Nerves rely heavily on oxygen and nutrients. When circulation slows, they begin to misfire. If this continues for too long, nerve fibers can become permanently damaged. And once that happens, balance, stability, and everyday movement can be affected in ways that are hard to reverse. Cold feet are another warning many people overlook. If your feet feel like ice, even when the room is warm, that usually means blood is not reaching the tissues with enough force. Good circulation brings steady warmth to the hands and feet. When arteries stiffen or narrow, warmth disappears, and the feet start to feel cold even under thick socks or blankets. For many seniors, this is one of the first indicators of developing arterial disease. And of course, there are the veins you can actually see. Varicose veins and spider veins often begin as small lines, then gradually become more prominent as the tiny valves inside the veins weaken. These valves act like gates that keep blood moving upward toward the heart. When they lose strength, blood pools in the legs, creating twisted blue or purple veins. Many people think of these veins as a cosmetic issue, but they are much more than that. They tell us that the veins are under pressure and the circulation system is struggling to keep blood moving in the right direction. All of these signs are important because they appear long before major complications occur. Your body is giving you a chance to listen early, to make changes before discomfort becomes disability, and understanding these early warnings is one of the most powerful steps you can take to protect your mobility and your independence as you age. As we age past 60, the body begins to change in ways that are quiet but very real, especially in the veins of our legs. Many people are surprised to learn that our veins contain tiny, one-way valves, whose job is to keep blood moving upward toward the heart. These valves open and close with every step we take. When we are younger, they work beautifully, but with time, they start to weaken. The tissue becomes thinner, the structure becomes less firm, and they no longer close as tightly as before. When that happens, blood begins to slip backward and pool in the lower legs. Over time, this creates the bulging, twisting veins so many seniors notice. Varicose veins are not simply something you see on the surface. They are a sign that the valves deep inside the veins are getting tired and need support. Another major factor is the gradual loss of muscle activity. The muscles in your calves act like a natural pump. Every time you walk, climb a step, or even shift your weight, those muscles squeeze the veins and help push blood back up to your heart. It is one of the most effective circulation systems the body has. But when activity levels drop, especially after retirement or during long periods of sitting, those muscles weaken. And when the calf muscles lose strength, the pump loses power. Blood moves more slowly, and gravity begins to win. This slowdown allows pressure to build inside the veins and makes it even easier for varicose veins to form. There is another layer to this. Slow, low-grade inflammation and cholesterol buildup can gradually stiffen the walls of the blood vessels. This process happens quietly over years. The veins and arteries become less flexible, less able to expand and contract with each heartbeat. When blood vessels lose their flexibility, blood flow becomes sluggish. The legs feel heavier. Swelling becomes more common, and the combination of weak valves, reduced muscle pumping, and stiffer vessels creates the perfect environment for varicose veins to appear and slowly worsen. All of these changes work together. Blood does not travel downward efficiently, and it does not travel back upward strongly either. What you see on the outside, the swelling, the heaviness, the dark veins, is a reflection of what is happening inside. And understanding these causes is the key to taking the right steps toward relief and better circulation as you move through your 60s and beyond. When circulation problems in the legs are left unaddressed, they can lead to complications that reach far beyond discomfort or appearance. One of the most serious risks is the development of deep vein thrombosis, or DVT. This happens when blood becomes stagnant inside a weakened vein and forms a clot in one of the deeper vessels of the leg. Many people do not feel the clot forming. It can begin quietly with swelling, warmth, or a dull ache. The real danger comes when a piece of that clot breaks loose and travels upward. If it reaches the lungs, it can block blood flow and become a life-threatening emergency. This is why recognizing early vein issues matters. It is not just about what you see on the skin, it is about preventing what you cannot see. Poor circulation also affects the nerves. Nerves depend on a steady supply of oxygen-rich blood to function. When that supply slows, nerves begin to struggle. At first, you may notice mild numbness, tingling, or a feeling that your foot is falling asleep more often. But over time, this lack of oxygen can damage nerve fibers and reduce your ability to sense the ground beneath you. Balance becomes harder to maintain. Walking on uneven surfaces feels less secure, and simple daily activities like stepping out of the shower or navigating a grocery aisle can become risky because the nerves are not giving your brain the signals it needs to keep you steady. Another consequence many seniors experience is the development of skin ulcers. These occur when blood flow to the skin is so limited that even a small scratch or blister cannot heal properly. The skin becomes fragile, the tissue underneath weakens, and wounds stay open for weeks or even months. Because older adults often have thinner skin to begin with, the risk of infection rises quickly. What begins as a minor spot can turn into a painful, slow, healing sore that requires medical care. And perhaps the most overlooked consequence of all is the gradual loss of mobility. When circulation is poor for a long period, the legs can feel heavy, stiff, or weak. Walking long distances becomes more tiring. Climbing stairs becomes more difficult. Standing in line at a store feels harder than it used to. These limitations develop slowly, almost quietly, until one day you realize you are avoiding activities you once enjoyed simply because your legs do not feel strong enough. Mobility is one of the greatest predictors of independence as we age, and circulation plays a central role in maintaining it. These are the reasons this conversation is so important. Varicose veins and circulation problems are not just cosmetic concerns. They are meaningful indicators of what is happening inside your blood vessels. And this is exactly why the four vitamins we will talk about next deserve your attention. They support healthy blood flow, protect the vessels, and help you maintain the strength and comfort you need to stay active and independent. When we talk about improving circulation naturally, there are four vitamins that consistently stand out for their ability to support healthy blood flow and protect the vessels that keep your legs strong. The first is vitamin B3, also known as niacin. This vitamin helps your blood vessels relax and open slightly, which allows blood to move through your legs more easily. Many of my older patients tell me they feel warmer feet and less heaviness when they consistently include foods rich in niacin. It also plays a role in lowering LDL, the type of cholesterol that contributes to stiff arteries, while raising HDL, the protective form that keeps your vessels flexible. You do not need supplements to benefit from it. Foods like salmon, tuna, skinless chicken, eggs, and almonds offer steady, natural sources. High-dose niacin supplements can cause a warm, flushing sensation on the skin, something many people find uncomfortable, which is why getting B3 from whole foods is the best and safest option for most adults. Vitamin C is another essential ally for anyone concerned about varicose veins or circulation issues. Vitamin C is the foundation for building collagen, the structural protein that keeps your vein walls strong and resilient. When collagen levels drop with age, the vessels lose firmness and become more prone to swelling and pressure changes. Getting enough vitamin C helps reinforce these vessel walls so they can support the blood flow moving through them. It also reduces inflammation, which is especially helpful for seniors dealing with chronic vein discomfort. Fresh fruits and vegetables are the easiest way to get what you need. Strawberries, oranges, kiwis, and red bell peppers are excellent sources. Because vitamin C breaks down when heated, eating these foods raw or lightly cooked helps you absorb more of the benefits. Vitamin K plays a very different but equally important role. This vitamin helps prevent calcium from settling inside your arteries. When calcium becomes embedded in the vessel walls, the arteries stiffen and lose the flexibility they need for smooth blood flow. Vitamin K works almost like a traffic guide, helping direct calcium into the bones where it belongs instead of allowing it to harden your arteries. It also supports normal clotting and helps maintain healthy pressure inside the veins. Leafy greens are your best friend here. Kale, spinach, and broccoli all provide generous amounts of vitamin K. Many people find that adding a handful of greens to a morning omelet or blending them into a simple smoothie is an easy way to build this into their daily routine. And when vitamin K is paired with vitamin D during a meal, the benefits for your arteries and bones become even stronger. Finally, vitamin E offers protective support through its powerful antioxidant effects. Your blood vessels are constantly exposed to oxidative stress, which can weaken their walls over time. Vitamin E helps shield them from that damage. It also boosts natural nitric oxide, a compound your body uses to relax blood vessels and keep blood flowing smoothly. That is one reason many people notice less tightness or fatigue in their legs when they begin to eat more foods rich in vitamin E. Some of the best sources are simple everyday foods. Olive oil, sunflower seeds, avocados, and almonds are all excellent options. While vitamin E supplements exist, they can increase the risk of bleeding for people who already take blood thinners, so focusing on food sources is the safest approach for most seniors. Together, these four vitamins help keep your vessels strong, flexible, and well protected. They support healthier circulation, help reduce pressure inside the veins, and give your legs the nourishment they need to stay active and comfortable as you age. Building them into your meals is one of the simplest and most effective ways to care for your vascular health every single day. Even with the right vitamins on board, your daily habits play a powerful role in how well blood moves through your legs. One of the simplest things you can do is keep your feet and ankles moving throughout the day. Every 30 minutes, take a moment to rotate your ankles or gently lift your heels off the ground a few times. These small motions wake up the calf muscles and help push blood upward. Many seniors are surprised at how much lighter their legs feel after making this a regular routine, especially if they spend long hours sitting at a desk, in a car, or on the couch. Another helpful practice is elevating your legs before bed. Just 10 minutes with your legs raised slightly above heart level can make a noticeable difference. It allows the veins to drain more easily, reduces swelling that builds up throughout the day, and gives your circulation a chance to reset before sleep. You can use a pillow, a folded blanket, or the end of the couch. What matters most is giving gravity a chance to work in your favor. Warm showers can also offer relief. Warm water naturally encourages the blood vessels to relax and expand a little, allowing more blood to flow through the legs. This gentle widening of the vessels helps reduce the feeling of heaviness or tightness that can build up toward the end of the day. Many older adults find that a warm shower in the evening not only comforts their legs but also helps them sleep more soundly. And finally, one of the most powerful circulation boosters is a short walk after meals. It does not have to be long. Even 5 to 10 minutes is enough to activate the calf muscles and improve blood flow. After eating, the body tends to direct a lot of blood toward digestion, and a little movement helps balance that out. A quick stroll around the block, or even inside your home, can make a real difference in how energized your legs feel throughout the day. These small habits do not require special equipment or big lifestyle changes. They simply work with your body's natural systems to keep blood moving and to support the health of your veins. Practice consistently. They help protect your circulation, reduce discomfort, and keep your legs strong and capable as you age. Your legs have carried you through every season of your life, and they continue to support your independence more than almost any other part of your body. When they begin sending signals like pain, coldness, heaviness, or changes in color, it is your body's way of asking for attention. The good news is that you have far more control than you might realize. With a few thoughtful choices each day, from simple foods to the right vitamins and a handful of easy habits, you can encourage stronger circulation, lower your risk of clotting, and keep your legs feeling steady and comfortable as you age. If what you learned today brought you a bit of clarity or reassurance, feel free to tap like so YouTube knows you appreciate this kind of helpful guidance.